Hi, I'm Dr. Lippy, and this is Dr. Barinholtz, and Dr. Barinholtz is going to discuss stapedectomy in the 60s, 70s, 80s, and 90s. Lenny?
Thank you, Bill. This is a very important subject. When I joined the fellowship about a decade ago, this was a great learning experience to understand what are the trends in otosclerosis and stapedectomy. We randomly chose 100 patients per decade over 4 decades and gathered the data, and we found some interesting things. We found that the average age has been relatively stable through the 1990s, from the 1960s, and most patients presented in their early 50s. We also looked at the duration of hearing loss, and this might be expected in that most patients in the 60s had a much greater duration of hearing loss compared to those patients in the 70s, 80s, and 90s, varying from 18 years in the 1960s to about 11 years in the 1990s. The preoperative audiogram was also interesting. We saw relatively stable bone conduction levels from the 1960s through the 1990s at about 30 decibels, between 30 and 35 decibels. However, the air conduction, the preoperative audiogram, was significantly worse in the 1960s at about 69 decibels to the mid-50 decibels for those patients in the 1990s. The word recognition was slightly worse in the 1960s at 83%, and in the low 90s in the 1980s and 1990s. Corresponding to the worse audiograms from the 1960s compared to the 1990s, the footplate pathology confirmed this, in that the thin or blue footplates only were about 38% in the 1960s. However, they're about 71% in the 1990s. So patients were presenting with less disease in the latter decade compared to 3 or 4 decades ago. The footplate drill-out percentages corresponded to this, in that a significant percentage of patients, almost 30%, required drill-outs in the 1960s, whereas in the 1990s only 6% required drill-outs.
You mentioned that the bone conduction stayed pretty stable in the 4 decades, although air went down. So this mitigates against anyone saying that we better do the surgery quicker, and preserve the bone conduction. Quicker doesn't mean you're going to preserve the bone conduction. However, quicker does mean you're going to have less disease. So there is, some urgency to do it this year rather than 3 years from now, but it's not because the bone conduction will get worse.
With increasing duration of the disease, particularly above 10 years, and a worse air-bone gap above 30 decibels, there's a much greater chance of discovering an obliterative footplate, and the otologic surgeon doing stapedectomy should be aware of this. We also looked at the incidence of bilaterality through the decades, and otosclerosis is a bilateral disease. In the 60s, 90% of the patients had bilateral disease. In the 70s and 80s, approximately 70 to 75% of patients had bilateral disease, whereas in the 1990s, only 53% of those patients have demonstrated bilateral disease.
Now that means that 50% is going to become 90% someday. So for the younger surgeons, some of the cases that we're doing now in the first year, you're going to do the second year 10 or 20 or 30 years from now.